Raysa. I'm a PhD candidate here at the University of Tübingen in the Department of Computer Science. And I'm going to talk today about my current project, which is intimate partner violence risk assessment tools, remarks on mechanisms, values, and impact. So a lot of that is actually ongoing work or like things that are still happening. And there's many things that I don't have answers for. So like as usual with ongoing work, it's always super welcome to have feedbacks or to exchange ideas. And since this is very interdisciplinary work, I very much welcome input from researchers from other fields. Yeah, so that's it. And to give a little bit of context, here just a brief overview of who we are and what we do. So we used to have the group on ethics and epistemology of machine learning, led by Konstantin Gannon. Some of you might know him. He's in Utah now, so the group officially doesn't exist anymore. But Sebastian and I are still PhD students here, and we are still like working together in these. Does it show or is it on the? I don't know. Yeah. Okay, so we define ourselves as a mixed background team of researchers working at intersections of machine learning, philosophy of science, formal learning theory, causality, and law. Of course, that's a lot. You will also notice that my approach here is more like, it's probably less analytical, I think, than previous talks that you've had. Because my lines of research are normally concentrated in investigating computer science applications to legal and public policy related settings. So I'm usually very interested in empirical questions. And some of the stuff that I study or have studied include understanding the use and validation of statistical evidence used in court or in legal settings in general. I have also explored some natural language processing techniques, some like legal text analysis. And currently I'm studying the evaluation of risk assessment tools used for decision making in criminal systems. So this is usually the realm I am in. And I'm in general very interested in gender issues. So this is the objects that I'm currently investigating. So I'm going to give a brief introduction and talk a little bit more about intimate partner violence risk assessment tools and what they really are. I will briefly introduce the debate that exists on clinical versus actuarial tools, and also how the whole machine learning approach kind of gets into this debate somehow. I will illustrate it with the case that we have in Spain, which is VIOHEN, this actuarial tool on risk assessment of gender violence, which is the one I'm currently focused. And I'm going to show some of the questions that are still out there on the matter. So we have this very well-known context of the use of prediction algorithms to support decision-making in settings of public interest. So we have several types of systems based on risk scores, things like, I don't know, healthcare assessment, or we have the very famous case of COMPASS, which is the recidivism prediction tools. And they have been extensively evaluated on metrics or on issues of things like accuracy or impact or fairness. And I mean, of course, those metrics or those features have been evaluated differently for different domains and with different depths. And usually the question is like, what's the harm versus benefit of using those tools, which is, of course, a very complex task technically, but also not just technically. It's also a value charged task, which the fairness literature, for example, worries with. And so my subset of interest here is intimate partner violence risk assessment tools. And like just a small, okay, so this is a brief overview. But before giving a brief overview, I should stress that there are, of course, many caveats here, many assumptions on using those kinds of things that can be questioned. Like, things like, should we use recidivism prediction at all to deal with this problem? Like, are the technological solutions really what should be used? So I mean, this can be questioned, but this is like also a whole debate that is worth its own chapter, which I'm not gonna dive in right now. But basically what we have here is the setting in which we have, let's say, a case of intimate partner violence or gender violence. And we have a tool in place that, like here I'm calling algorithm, and this could be many different things, could be a structured clinical judgment, could be like formulas or like regressions to predict risk. Usually the data we use to like feed the algorithm is information from the case. So for example, if a victim goes to a police station, they can self-report what happened. There might be structured surveys for them to respond. And with the data, the algorithm is supposed to give as an output a risk score of an outcome of interest. Usually this outcome of interest is something like, what are the odds of this happening again? And then some decisions should be taken according to that risk. So usually the setting in which this is applied is institutions like law enforcement institutions, or some surveys are designed to be applied by first responders or healthcare professionals or social workers who are in direct contact with the victims. And usually the kind of decision that is made from this risk score is victim-focused intervention. So there's this assumption that is usually true in practice, that the resources are limited. So for example, you have a pool of cases or a pool of victims, and you have limited resources to allocate to each case. So one might ask which cases are riskier and might grant more intervention or more intense intervention. So for example, if we have just a limited amount of spots in a shelter, who should be granted those spots? Who are the, like, which cases are risky enough to like, let's say, deserve a spot in the shelter, and which are the ones who might not need that intense of an intervention and might need just a follow-up call or something like that. So those resources are supposed to be allocated according to those risk scores. So this is what I'm calling here victim-focused interventions. And in this context of risk assessment or recidivism assessment or violence assessment, or in this larger realm, there is an ongoing debate on what we call clinical judgment versus actuarial judgment, or statistical or mechanical judgment. There are different names in the literature for it. So not just in intimate partner violence, but in broader violence risk assessment. And usually the definitions go something like this. The clinical judgment is supposed to be this informal or intuitive process to combine or integrate client data. And what we can call statistical or actuarial judgment is empirically established relations between client data and the condition to be predicted. This is an old debate, actually, like it spans from the 50s or something. These definitions are from this paper from 2006. Despite the age, and it's a bit outdated, but for those who are interested in that reference, it's an interesting meta-analysis of like many decades of research on this debate. And it provides like a very comprehensive review and some useful concepts. So which context are we talking about here? Basically, whenever we have a situation in which someone, like some professional, maybe it could be an expert, make some decision based on some data that they have. So for example, this review in particular focuses more on the context of forensics and clinical psychology, but it could be in other cases. For example, when we think of educational assessment, we want to know who should be given spots on a certain school, like who is more likely to perform a certain way, or things like that. There is, of course, classic systems from healthcare. For example, we can think of the very standard textbook clinical judgment situation, which is in medicine, when you go to the doctor, they should make a clinical assessment of your situation, and they could maybe make a decision on, oh, we need follow-up exams on that, or based on the information that they have, I could diagnose you with X or Y or Z. And I mean, here it's the distinction is very very strictly put, but one could argue that this is actually more of a spectrum. Like, of course, there's a range of things you can do between those things. You have like this quote unquote purely clinical assessment, which is like much less structured, or at least it's not, it doesn't have this an explicit structure. And you have in the other side of the spectrum approaches that can be very much just statistical. So yeah, here I drew some names that the literature used to refer to those different approaches of making those decisions. And in theory, you would expect this side of the spectrum to be like more explicit on structures and mechanisms, more reproducible, more, let's say, well-defined, and less sensitive to training and expertise. Like if you think of a purely clinical assessment, ideally you would want that assessment to be made by an expert or someone who might have a better grasp on how to make that decision. And I mean, of course, like I said, this is an ongoing debate. Sometimes it's very hard to know what an expert takes into consideration to make a decision. But this is what part of the AI literature tries to explain. Like, for example, if an AI or an algorithm or something is going to draw a conclusion, and we want that conclusion to be as close as possible to the best evidence that we have, or to the best information that we have, what would it look like and which rules should we follow? And of course, for each one of those applications, for each one of those different methods, we could raise different questions on what are actually the best ways to do it and how we can actually evaluate them. So, I mean, of course, there's a lot of overlap and nuance between those terms. When I say clinical or statistical or actuarial, I'm thinking of maybe the archetypes of those approaches, but there's a lot of overlap here. And so what we have, the remarks that we have from many decades of research on the matter, on like what is the best way to make decisions in that kind of setting. And again, all of that can be debatable, but on a high level view on the results of that kind of research, what we have is that usually statistical approaches are at least as good as clinical approaches. They are often better. And here I add an asterisk because one could also debate what does better mean. Usually it means accuracy. When clinicians are experts, they are normally more or less equivalent to statistical approaches. Otherwise, statistical approaches tend to be consistently better. Again, by better, I mean more accurate. And one thing that is very interesting, and at least for me, it might be a bit counterintuitive, is that usually that kind of research shows that clinicians are actually more accurate when they're dealing with novel information or unfamiliar information. And when they are exposed to more information, their accuracy is decreased. So here we might draw a discussion on the importance of the blindness of the expert. And a quick parenthesis here, we also have that kind of discussion when we are talking, for example, of forensic evidence to be used in court, when a forensic expert needs to, for example, make a report on some evidence that was found. Some researchers argue that the less the expert knows, the better their assessment is, in the sense that they should only focus on the very essential information to make their technical report. They should know the least amount of information as possible from the case. And what I also find very interesting is that the whole framework of machine learning, and again with an asterisk, because machine learning could be a myriad of things. Here by machine learning, I mean roughly like models that are at least something more than a fancy regression, or something that is less explainable than classical, like actuarial, more classical statistical approaches. This whole framework of machine learning might challenge a bit some of those assumptions or force us to review some of those, because in machine learning what we have is the opposite. We have like we don't seem to have blindness at all. There's the assumption that the more data that we have, the better the model is, or more accurate the model is, even though they might be less explainable. So that might be a trade-off that we need to learn to navigate when we are using those systems to make that kind of decision. And of course, there's also another question, which is how should we evaluate those systems? So there are classic approaches from, again, literature and statistics, which is worried about reliability of systems or validity, internal validity, external validity, how feasible the system is. The machine learning literature has added some approaches that some might call auditing of algorithms. It's also not very clear what auditing necessarily means. There's all of the ongoing debate on fairness and new keywords that emerge in the discussion, and there seems to be all these features that we need to be worried about when building those systems and when interacting with them, many values which might be at stake, so which maybe should be worried about who is accountable or how transparent the system is. And there's also in my opinion, a bit overlooked aspect of that evaluation, which is impact evaluation. Like one can look at the system and actually try to audit it and extensively evaluate it. But we maybe should also not miss the big picture of evaluating impact in terms of policy evaluation, because if we implement an algorithm as policy, we might want to evaluate not just the algorithm, but also the policy. And then maybe we might want to use approaches from economics, for example, things that might help us understand better causal relations between using those algorithms and what outcomes do we want in society. So to bring back a little bit the discussion specifically on intimate partner violence risk assessment tools, this is a very brief overview on a subset of some of the tools that are out there. And here again, I drew a hard distinction between what's called structured clinical judgment tools and actuarial tools. You might see that some of those have been around for a long time, so this is actually not super new stuff. And many of those are used in the US or Canada. Here in Germany, we have this private company that released their own tool in 2012. And we have probably the most famous current case, which is VioHen. And so what is VioHen? They call it integral follow-up system in cases of gender violence. It's a whole effort. It's part of a broader policy of the Spanish Interior Ministry, which spans from 2007. And so it's a system that basically works with this protocol that must be followed by police stations who deal with cases of gender violence. So they have a structured survey, and they have what they call an actuarial formula to draw the risk scores for each case. We don't have actually access to what those formulas are. There are some published papers which explain the functioning, but I mean, of course, it's not super open. There have been they have been talking on adding machine learning to the system. To me, it's not necessarily very clear what that means. like what maybe they mean that they might add new techniques of machine learning to what they already do, which is basically regression with the past data of other cases. The system is currently used in the whole country. It's a protocol that it's mandatory to follow, except in Basque Country, which has its own tool, and Catalonia, which has the traditional human assessment protocols for dealing with gender violence. So, I mean, of course, there have been public concerns on using this kind of thing. Many independent audits have been made, and they usually raise issues on transparency and access to data. Of course, one can argue that these kind of solutions miss the big picture of the problem, that an algorithm might not be what we want. In 2024, we had this news from the New York Times, which raised some criticism on the system, because there have been cases in which, when the system made a mistake, the consequences have been actually deadly. Like in this case, when an algorithm told police she was safe, and then her husband killed her. So the system decided that some case was low risk, for example, and it turned out to not be low risk, and in that case the consequence was obviously not what one might want. However, there's also an issue of okay, what we had before was not necessarily better, in the sense that the way that these cases are usually held in a police station, for example, by a person who is there who might not necessarily be an expert, who is like a police worker, who is not necessarily trained in gender violence, their individual assessment might not be better than following a patterned, standardized protocol. And there is also the issue of, okay, we don't actually have an evaluation of this as a policy. We have many papers vouching, many research vouching for the accuracy of the system, but we don't know what the impact of using the system was in a more broader way in terms of outcomes. For example, when we think of indicators on gender violence, like did it actually make things better or worse, or didn't change things at all? And one might also ask, if we had just purely human risk assessment, would we have had different results in such cases? I actually don't know. And yeah, so from all of this, the general question that I ask myself is it better with the system than without the system? And I think for that, we might want to compare outcomes in the presence of the system versus absence. And of course, we have a whole issue there of how do we actually draw causality from those from that data, which is not a simple thing to do. Maybe the system does introduce some harm to society, maybe it does introduce some benefit, and we should maybe come up with ways to evaluate that and try to understand the mechanism behind those harms and benefits. And I think one thing that could be asked regarding the setting is, when we have those high-stake decisions, maybe we might be more comfortable with human mistakes than mistakes made by I don't know, some statistical tool or algorithm tool or whatever. Or we have reasons to believe that those mistakes might be more legitimate when they are made by a human, and that might be okay. I don't know. For example, there have been some concerns about how these kinds of tools, if implemented like more widely, they could lead to situations in which you don't have anymore like the presumption of innocence when you decide that some case is high risk without having had a proper judgment on that. But the thing is, we already make that assessment as it is. And maybe there are reasons to believe that those mistakes, when those mistakes happen made by humans, they might be more legitimate. And it might also be the case that those statistical or actuarial or machine learning or whatever tools or approaches might be actually an acceptable compromise for a suboptimal setting. And by suboptimal here, I mean not in a mathematical sense, but like socially suboptimal, because the ideal approach which we would have in this kind of situation is to have like qualified experts or professionals who know how to deal with victims of violence and who know how to address the problem individually in each case, which is very far from what we have. And in that case, the standardization brought by those approaches might be an acceptable compromise. They might. I don't know if they are, actually. This is an ongoing question. So that's, I think that's one of the main tensions that I think arise in the use of those approaches. And this is what I mean by when I say that we need to maybe make an assessment of values that are at stake when we use that kind of solution for high stakes decisions. So this is it for today. Thank you so much for your attention.